Being diagnosed with cancer is both shocking and scary, but the good news is many cancers can be highly treated if detected early. Cervical cancer was once a common cause of cancer death in American women. About 14,000 people in the United States are diagnosed with cervical cancer each year. And around 4,000 people die of cervical cancer per year. Thankfully, due to the advances in medical technology, this rate is on the decline due to regular screenings and the HPV vaccine. Cervix is an important part of female reproductive anatomy that connects the body of the uterus to the birth canal. Cervical cancer or cancer of the cervix begins on the surface of the cervix. It happens when the cells of your cervix begin to change to precancerous cells. Not all precancerous cells will turn into cancer, but finding these problematic cells and treating them before they can change is critical to preventing cervical cancer. Receiving regular gynecological exams, getting Pap test, and practicing safe sex are the most important steps that you can take toward the prevention of cervical cancer. The tests for cervical cancer screening are the HPV test and the Pap test. Precancerous changes can be detected by the Pap test and be treated to prevent cancer from developing. In a Pap smear, cells are scraped from the cervix and examined under a microscope to check for the disease or other problems. The HPV test looks for infection by the high-risk types of HPV that are more likely to cause precancers and cancer of the cervix. HPV infection has no treatment, but a vaccine can help prevent it. Everyone through age 26 years should get HPV vaccine if they are not fully vaccinated already. HPV vaccination is not recommended for everyone older than age 26 years. However, now men and women up to age 45 can get vaccinated after consulting with their doctor. Early stage of cervical cancer generally produces no signs or symptoms. Symptoms often do not begin until the cancer becomes larger and grows into nearby tissues. Some of the common symptoms include vaginal bleeding after intercourse, between period, or after menopause, watery, bloody vaginal discharge that may be heavy and have a foul odor, pelvic pain, swelling of the legs. These signs and symptoms can also be caused by condition other than cervical cancer. Still, if you have any of these symptoms, see a healthcare professional right away. Ignoring symptoms may allow the cancer to grow to a more advanced stage and lower your chance for successful treatment. Having multiple partners, a weakened immune system, smoking, long-term use of oral contraceptives, and an exposure to miscarriage prevention drug DES can all increase your risk for developing cervical cancer. It isn't clear what causes cervical cancer, but it is certain that HPV plays a role. HPV is very common and most people with the virus never develop cancer. This means other factors such as your environment, your lifestyle choices also determine whether you will develop cervical cancer. Cancer of the cervix develops slowly and over many years. Although there is no cure to cervical cancer, you can take steps to reduce your risk of getting it by scheduling regular gynecological screening and practicing safe measures from transmitting the disease. For more information, please log on to www.cdc.gov/cancer. Thank you for watching, and I'll see you with another video.